here on 420radio.org.
Welcome back, everyone. 15 after the hour, and time for us to go behind the headlines as positive drug tests for opioids and amphetamines double as marijuana positives are now the lowest ever. According to data analyzed by Quest Diagnostics for its drug testing index, the nation's leading provider of workplace drug testing, positive tests for amphetamines like Adderall have more than doubled since 2002, while positive tests for opioid drugs like Vicodin and OxyContin have risen 172% and 71% respectively since 2005. Meanwhile, positive tests for cannabis in the index have fallen in the past few years to the lowest levels ever recorded, with just 2% of all drug tests indicating cannabis use, a reduction by almost half since 2002. Overall, drug test positives have declined from over 10% to about 4% nationwide, with over 43% of all positive drug tests attributable to marijuana. Fewer failed marijuana drug tests might indicate that workers are using marijuana less, but federal surveys do not seem to bear that out. The National Survey on Drug Use and Health found in 2002 that 48.6% of people employed full-time had never used marijuana, a number that is unchanged in the latest 2011 survey. If you consider only past month use, there are slightly more full-time and part-time employees regularly toking now, when the positive drug test rate is 2%, than in 2002 when the rate was a hair below 3%. If toking habits haven't changed much, then drug test taking must have. Experts hypothesize that workers have become more adept at beating drug testing, whether it is through the use of masking agents, synthetic urine, or simply detoxifying before the test. Unfortunately, testing has also led to the emergence of the so-called synthetic pot that isn't tested for, incentivizing pot smokers to try these untested potent drugs to beat their test. The results have been an increasing number of tokers headed to emergency rooms, unable to adequately moderate their use of these powerful synthetic cannabinoids. The Drug and Alcohol Testing Industry Association, or DATIA, is a powerful lobby that represents over 1,200 companies and fights efforts to legalize marijuana, believing that the growing acceptance of marijuana, or as they put it, medical marijuana, in scare quotes, presents a danger to the workplace. Quote, marijuana still impairs a user's ability to safely operate a motor vehicle or stay awake on the job, end quote, claims their seminar materials for The Marijuana Dilemma and What Employers Can Do About It. So, wouldn't that danger apply in spades to workplace users of powerful opioids and amphetamines? The Director of Science and Technology for Quest Diagnostics Employer Solutions, Dr. Barry Sample, yes, really, Dr. Sample, explains, quote, our data show that an increasing number of workers are testing positive for certain prescription drugs, such as opiates and stimulants. Even when used under prescription, these drugs can have an impact on workplace safety, end quote. But according to the Wall Street Journal, quote, independent studies suggest that 65% to 80% of positive tests for amphetamines and opiate use are ultimately disregarded because the user has a valid prescription for the drug, end quote. When about 4 out of 5 people are failing drug tests for OxyContin and they get to keep their jobs thanks to a doctor's note, and hardly anybody failing a drug test for cannabis gets to keep their job even in a medical marijuana state, it doesn't really seem like workplace safety is what's the issue here. And color us unimpressed by appeals to workplace and user safety when the FDA has just approved the prescription of the new drug Zohydro, an easily abused version of Vicodin that is 10 times as potent. Stay tuned for Hour 2 in Toker Talk Radio. We're going to tell you all about Zohydro, this new super Vicodin that was just approved by the FDA, and give you some even more chilling statistics about the rising abuse of opioid painkillers in America and how the DEA is actually facilitating that abuse hand in hand with their partners in big rehab. There's a lot of money to be made in getting people addicted to pills, selling them the pills to get off that addiction, and then selling them the rehab to get off of the pills. We'll talk about that in Hour 2, Toker Talk Radio here on the Russ Belville Show. And stay tuned, because coming up next, we've got our Roots Monday Daily Toker Tune. Bacon Dan will be calling in with some new music here from the Radiators for us on this fine Monday morning. And remember, we've got all sorts of great shows coming up the rest of this week. But first, it's time for us to take a break. It is Union Rules, after all, 20 after the hour, hoping you're able to celebrate in the way you would prefer. And if not, I guess I'll have to celebrate a little extra for you. Be right back.
Have you ever met that funny reefer man? A reefer man. Have you ever met that funny reefer man?